Hi everybody, welcome back to my channel. You're catching me fresh after a work day, so forgive my appearance, but I was thinking today about some things that have happened when I worked in the facility over the years, many years ago. And I started when I was 19 doing CNA work, so a lot of things happened that made me realize that elderly folks, geriatrics folks, are adults too. But I thought first I would share some things that happened during my nursing career that replay in my mind over and over again. For example, I may have talked about this already, but it just is something that I can never forget. When I was a newer nurse, I had a patient who had constipation. And one of the things that our doctor liked to order, and this was years ago, we're talking 20 some years ago, one of the things that our doctor liked to order when I was a new nurse was milk and molasses enema. I'm just going to tell you, it really does work. We would get a soap suds enema bag, hang it on an IV pole, and administer it. But I did not expect what happened was going to happen to me. So I say this to say, when you are a nurse, always carry a change of clothes in your bag. Why do we carry these big bags? Because things happen. We work with people, we work with bodily fluids, disgusting things happen sometimes, and you need a change of clothes. I wish I had a change of clothes. So I went to administer an enema. It was the perfect temperature. You need to make sure that it's warm, but I explained the procedure. I put the tubing in, and I really don't know how it happened. I really don't know how it happened. But the patient shot the tubing out. I apparently didn't have it secured with my hand well enough. Shot the tubing out, and then the enema tubing. I don't know if you've ever seen a soap suds bag, but it's like an IV fluids bag with a tube on it that has an enema on the end. And it was swinging around. I wish I was good at skits because that would be hilarious. But that is one of the things that happened to me, and I had milk and molasses enema, and molasses is so sticky all over me. Not BM, thankfully, but that's not to say I've never gotten BM on me, okay? When I was a CNA, first learning my job, I didn't always know how to transfer people effectively without having to do a couple of lifts at one time. And sometimes working as a CNA, a person truly was a one-person transfer, but they needed maximum assist. And you really had to have a good experience to put the chair in the right place next to the bed and get the person onto the bed in one shot where they weren't hanging off about to fall. I have had people relieve themselves on my shoes. So, like I said, always carry an extra pair of shoes and an extra pair of clothes in your nursing bag. Carry something for a headache, carry something for a stomach ache. The reason that nurses carry such big bags is because we're gone from our home for so many hours, and a lot of us work so far from home that if something happens, we do not have access to get what we need. So always carry a uniform, because I can't tell you how many times I've gotten things on me, but especially from that enema. And there was one time when I was a treatment nurse and I had an assistant with me that day that I walked into the room and the patient had painted with feces all over the bed rail, all over themselves. And when you're a nurse, you have to clean that up. So let's talk about some other things that I think about. Let's be realistic. This is where I said geriatrics folks are adults too. They say sex. That's an uncomfortable topic to talk about, but when you're a CNA, when you're a nurse, if you've never done it before, working as a nurse or a CNA, there are going to be times when you walk into situations that you need to be prepared for, and one of those situations is people having sex. It happens. It happens in nursing facilities. And I remember being horrified when my CNA instructor told me that that was a possibility, that people might be having sex. Well, you know, as I get older, I realize that that's a possibility if you're able. You know, people have needs even when they're 90, I guess. I remember the first time I walked in a room, I had to take care of a patient, and they weren't in the act, but they were laying in the bed together, naked. And so I politely closed the curtains. My face, I'm sure, was beet red because I needed to change this patient. It was time. And I tried not to look and close the curtain, and they ripped the curtain back open. They wanted to be seen. It was horrifying. And that's when I realized that I really had to time my cares better. I needed to be aware of what was happening in the rooms. For example, sometimes you have husbands and wives that are together, and you're going to walk in on stuff because how do you think your parents got here? How do you think you got here? That's how it happened, and it doesn't stop just because grandma and grandpa are in a nursing home. It really doesn't. So just be prepared for that. I was not prepared for that at 19 when I was a CNA, but I had many episodes that I encountered regarding that also. Humorous things that happened. There were a couple of people who I thought did not like each other. They were always bantering. They were always yelling at each other. They were always saying insults to each other. Little did I know they were flirting with one another, because I did have to write an incident report about finding my patient on her knees. Yeah. And she couldn't get back up. So then there comes the topic of how do you tell the families? Some patients are in their right mind and they can make those decisions themselves, even if their family doesn't like it. They have the right to make those decisions and do those things. It's an uncomfortable subject, but it's something that you should be aware of when you're a nurse or a CNA. Patients have rights. They have the right to do that if they want to. And if they're not consenting and the family doesn't have a problem with them doing those things together, then that's also another consideration, because sometimes your people with dementia will also do those things. And in some states, in most states, I'm pretty sure the family has to consent to that. So then the question becomes, how do you bring up that topic? How do you discuss that? How do you tell someone that you found their mother on her knees? I don't know. I think I tried to be as careful as possible and discreet in my documentation, just documenting what I saw in that case, about the patient that was on their knees and not about the person that was in the wheelchair with the patient on their knees. It was a really awkward experience, but it was an incident report that I had to do and had to explain. And, the families did eventually, they were aware that those two people were having those type of relations, and it was a very delicate subject to review. Remember, it's still uncomfortable for me at 47 to talk about. That's how traumatized I am by it sometimes. And then there's things that happen when you are giving cares with other people. When I was 19, I hadn't seen anybody else in the nude. And I will just tell you that when I was turning the patient, a part slapped my leg and made a loud noise, and I was thoroughly embarrassed by that. And I just say this to say that when you're taking care of people, embarrassing things can happen and you just have to move on from it. However, I say that, but I still think about it, and I bet you my cheeks would still turn beet red if I was in the presence of those particular workers, if they said what they said to me at the time. But you begin to not be so uncomfortable with it. The more that you're around people and the more that you do your job, the less you react to those things that shock you when you're a baby nurse or a baby CNA, and you can get through it. You just have to be professional about it. Close the door. If it's not unsafe, if it's not harming anyone, close the door and give the people their privacy. That's what was always the policy where I worked. Obviously, if they're consenting adults, you wouldn't let somebody go in there and hurt somebody if they weren't consenting to it. Obviously, you wouldn't allow that to happen if it wasn't. So the topic is, what do you do? When is it okay for people in facilities to engage in relations? And that is, if they are both consenting and they want to, they have the right to. So you have to be aware of that. Be aware that that may be something that you might encounter. And it's not something that's talked about a lot, but it is definitely something that's happening. And when I'm talking about facilities, I'm not talking about hospitals with young people at all. I am talking about people in their 70s, 80s, and 90s that you will encounter that still have those desires and still have those needs and still have those rights to do those things if they're consenting, even if it's not their husband or wife. And sometimes you will see that as well. Sometimes you will see people who are married to other people doing consenting things with other consenting adults. And when you're a nurse or a CNA, you are going to definitely run into those times at times. So just be aware of it, be professional, shut the door, give them privacy. And also, if you're a CNA, you can just let your nurse know, and your nurse then has to be the one to handle it. They usually know what's in the chart, in the care plan, and believe me, that would be in the care plan. Know your state's laws if you're a nurse, know your facility's guidelines about it, and give the people their privacy. And there's my uncomfortable topic of the day. If you have any interesting stories that you'd like to share with me about things that you encountered in the early stages of your career, I'd love to hear about it in the comments. Please like, share, and comment if you like what you see, and I will talk back with you. If you ask me a question, I'll be happy to answer it, and I hope to see you soon.